speaker for today, Samantha Allen. Samantha is a sustainability and healthy building expert with accreditation in WELL, LEED, and BREEAM. So previously, Samantha managed the overall market development of the WELL Building Standard, WELL Community Standard, and WELL Portfolio Program in Southeast Asia. Samantha's background in scientific research specialized in environmental science, material safety, as well as organizational policy. Samantha has also held roles in research and development, evaluating building technologies and materials, as well as in marketing and communications to help impart an understanding of scientific research and to a wide range of audiences. She has held academic research roles at Hong Kong City U, New York University, Xiamen University, and Vassar College. Samantha holds a Master of Public Health and Environmental Health Science and Policy from Columbia University, and a Bachelor of Arts in Psychology in Vassar College. Without further ado, I'd like to hand over the floor to Samantha Allen to start off our presentation for today.
Thank you for the kind introduction, Cha. Okay, so what we're going to be doing is discussing public health indoors, and as Cha mentioned, hopefully this isn't like a typical webinar where I'm just going to present to you bluntly and then there's a short question and answer and you've forgotten your question at the end. We are going to try and stop and start it, so if you do think of something, please type it into the chat. If you really need to say it, then you can unmute yourself and ask right away. But Cha will be stopping me throughout to ask some questions as and when they come up. So keep that in mind. Thanks, guys. Okay, so what are we going to be talking about today? First, I want to just briefly touch upon what public health is, and then talking about the state of the global workforce, both pre and post COVID, or pre and current COVID situation. And then I want to talk about aspects of the built environment that impact our physical health and well-being. And then I want to talk about aspects that impact our mental health and well-being. It's important to remember that you really can't have good physical health without good mental health. They really do go hand in hand. And also our mental health plays a lot into our productivity and the productivity of our staff and employees. And then we're going to talk about a little bit about how to construct an intervention strategy and then test your outcomes as well. I'm not going to give you the strategy exactly because that's going to vary by company to company and by your different needs, but I will be talking about how to formulate that strategy. Okay, so